The trans craze is attempting to take over the world, specifically targeting our children. The United Kingdom's health system says it will no longer be chemically castrating children or mutilating their bodies in the name of so-called gender-affirming care. Doctors there rightfully concluding that there is no proof that this helps children. More evidence continues to emerge that children are actually being harmed and suffering lifelong detrimental consequences as a result. Joining me now to break this all down is human behavior specialist Jamal Javanji. Also with us is policy analyst and Project 21 member Donna Jackson. Welcome to you both. Donna, we're seeing this happening in the UK, thankfully, and back here at home, 18 states have already bans child mutilation, this chemical castration. We're recently seeing that I think she's now 16 years old, that back when she was 13, her breasts were cut off. So for the people out there that are saying, oh no, the surgeries aren't happening to children, they're happening more and more. What's it going to take for this to end all across the world? I can't even believe we're having this conversation in the first place.
You know, you have to realize it's the pot of gold at the end of this rainbow that's been the big motivator, because for the medical community, they make a lot more money mutilating kids than they do routine assessments for our kids. But, you know, it's undue duress and stress and influence that's actually causing this confusion. And until we realize that these people cannot be allowed to do this type of thing to our kids when kids are not even mature enough to understand what's happening to them. But this political motivation that says that we should be embracing this, and it's more motivated by money than anything else, is what's causing this castration.
Absolutely. Now, Jamal, Texas Congressman Dan Crenshaw, like so many, he firmly believes that these surgeries are not, they're harming our kids. He had this exchange with one witness during a committee hearing this week. I want you to take a look at it.
Tell me a journal that has done systematic reviews that cites different evidence, that cites strong evidence for benefits of these therapies. Tell me one.
The standards of care.
That's the standards of care. That's not a journal. That's not a study. That's not an organization. That's not an institution. You're just saying words.
And in fact, we're actually seeing the opposite, more and more evidence, just how detrimental these surgeries and hormones. People don't realize that the hormones they're injecting these children with have to be taken for the rest of their lives. They're the same chemicals that people use for hormonal cancers. So what are we going to see? 30-year-olds with osteoporosis and heart disease?
Yeah, it's a very alarming trend, and I celebrate the recent UK decision to ban these devastating drugs and treatments that we know. There's a lot of data that show that, as you mentioned, that this causes tremendous damage to the human system. But you know, it's kind of par for the course. We've set a very low bar, unfortunately, in the healthcare industry, in which we're now celebrating a decision to limit the damage done by the same healthcare industry. What we're not addressing is the real crisis that's happening amongst our young people, especially in the West. There was a recent CDC study done. I think they surveyed 170,000 high schoolers. 30% of girls were actively, and this is alarming, they were seriously considering suicide. A third of all the folks that were surveyed had, acute symptoms of depression. And we're not addressing this, because we're treating gender as if it's a disease. And I just want to say, our gender is not a disease. It's not the cause of the mental health crisis that we're facing today. We need to get to the roots of it. But we have a medical care system that just throws medications and surgeries in an attempt to deal with systemic issues that we need to get to the root of it.
It's like giving liposuction to somebody who thinks they're too fat, they're anorexic. It's not the answer. I want you both to listen to this soundbite and then get your reaction. We have only about a minute and a half left. Biden's Assistant Health Secretary, Dr. Rachel Levine, says he believes that mutilating children is medically necessary and actually safe, despite there being no evidence. Take a listen to what he said.
Gender-affirming care is medically necessary, safe, and effective for transgender and non-binary youth and adults. Those who attack our LGBTQI plus community are driven by an agenda that has nothing to do with science and medicine. These are politically and ideologically motivated attacks, again, on trans youth, and they are contrary to the overwhelming science and evidence.
But here's a hypocrisy, guys. This Admiral Levine, Dr. Rachel Levine, he's on record saying that he's actually grateful that he didn't transition earlier because he was glad he was able to have children. So why is he denying that capability to children now? It's insane to me. I'll get your reaction, both of you. Donna, you first.
It's the political pressure from this donor class that is saying that this is the #1 issue today, and it's more about money than anything else. I'm sad that this is the direction we're going in.
And Jamal?
I would agree with those sentiments. We really have a strong need to disentangle politics from science, from healthcare. If we let the medical professionals speak as they did in the UK, nobody would. This is just common sense. We would not prohibit the biological process of our young people from going forward. It doesn't solve the root of the mental health crisis that we're facing today. So let's let the medical professionals speak, and let's get politics out of the conversation entirely.
Absolutely. Jamal Javanji and Donna Jackson, thank you so much. And Jamal, happy Father's Day to you.
Thank you so much.